Hello, everyone. Today, my team and I are going to talk about the overdose crisis resulting from opioids and provide a solution for the community. Canada is in the midst of an opioid crisis. There have been more than 19,000 suspected opioid poisoning deaths since 2016.
Nowadays, most of the harms experienced are due to fentanyl, a synthetic opioid that significantly increases the risk of overdose. It has been recorded that 85% of overdose fatalities in Canada involve fentanyl. And in BC, there are 5.5 opioid overdose-related deaths per day. These statistics make this emergent issue a leading public health and safety concern. Initiatives tend to focus on the physical consequences of problematic substance use, such as the Canadian government's recent $20 million funding for the distribution of naloxone kits and opioid overdose response training. However, there is a lack of interdisciplinary care in terms of the resources available to support individuals' psychological and emotional needs who struggle with opioid addiction. In addition, the negative stigma associated with opioid addiction often leads individuals to suffer in silence or isolation, especially during a global pandemic. However, our approach intends to bridge this divide and help connect individuals with industry professionals, those who have personally struggled with opioid addiction, as well as mental health resources to help provide a more comprehensive quality of care. Reaching out on our peer mentorship app aims to provide a safe and accessible platform for individuals struggling with opioid use to seek guidance from trained professionals. These professionals can then connect individuals to various resources such as connections to healthcare and community services such that our web or mobile app users are able to feel supported and safe. Mentors could also consist of volunteers who are in long-term recovery and are willing to share their unique experience with current patients. Nowadays, it is hard to find easy and accessible information online. Many resources regarding substance use disorders are dispersed, each with their own websites, centers, and staff. However, our platform as a web app and mobile app would 1. Provide users with an overview of all available resources regarding mental health and substance use disorders, and 2. The app would also create an opportunity for learning more about these important issues. Eventually, reducing stigma by opening up conversation on substance use disorders. Moreover, we would have doctors and therapists host webinars where individuals from all backgrounds will learn about the opioid crisis and where to get help if needed. Finally, our app would centralize health services by enabling app users to set appointments to reach out to professionals and talk to mentors, all in one account.
In order to achieve our goal of connecting app users with mentors, we will partner with existing mental health organizations, such as Coast Mental Health Programs, PHS, and other rehabilitation centers who are willing to volunteer for our events and one-to-one peer mentorship sessions.
Through our partnership, we aim to create stronger connections with the mentor volunteers and give them the ease to run their mentoring programs from anywhere. Our virtual accessibility will help us provide more resources and at a faster pace to the community. The app will help us spread information to a wider audience and enable users to save time and money by not having to visit care centers, which are not always easily accessible.
Thank you for listening.